Sitting is probably the worst thing for your back, and it's causing more back pain now than ever. And matter of fact, it's causing back pain that's becoming chronic. And there are 5 main reasons why you have back pain from sitting. And each one of them compounds on the other to the point where it can be devastating. And you don't want to have a devastating back pain because it affects every aspect of your life. I want you to like my video, subscribe to my channel, click the subscribe button and the little bell next to it. Share this information because we have a way out for people that in the past had no way out of their back pain. So we're here to help. Comment, ask any questions. You can say whatever you want. I am pretty tough. I can handle it. So back pain is getting worse. In 1990, 5% of the population had chronic back pain, and chronic back pain is the back pain that doesn't go away. Now it's up to 10%. So it's doubled. And it's doubled as a result of the fact that we sit almost 8 hours a day. We sit in our cars going to work, we sit at work, we sit in our cars going home, we sit when we get home to have dinner, and then we sit to watch TV before we go to bed, and then we start all over the next day. So sitting is a big part of our life, and the effects on our health are devastating. It's not just bad for the back, although it's terrible for the back, but it's bad for every aspect of your health. There are 36 chronic diseases that are the result of sitting too much. And you can have control over all of your health if you can fix your sitting. And certainly you can fix your back pain, which is why you're here. So 24 vertebrae between the head and the hips. In between each vertebrae there's a disc. The disc allows for motion. The disc is a lot like a jelly donut in the sense that the outside of the disc there's a thick material. Inside the disc there's a jelly-like substance. The spine is designed to function best in 3 positions. Curves in, curves out, curves back in. The curving in is called the lordosis. So a healthy spine has a lordosis. But what happens when you sit for too long, you get what's called ligamentous creep. It's stretching of the ligaments. So what happens is ligaments stretch from the seated position. The seated position tends to put you into a flexed position. Slightly flexed, but flexed enough to where you start to stretch all the ligaments and tendons that support the spine. And what happens is a normal lordosis will start to flatten out. You will lose your lordosis. So this is the healthy lordosis over here. But what happens when you sit too long is it starts to straighten out. And the spine is designed such that when it's in the lordosis, the stresses are distributed evenly across the disc. But when you lose your lordosis and you're stretched out a little bit and you lose that sort of curve and it straightens out, the result is the discs will start to push into the area of the spinal canal. The flexed position will force the nucleus out and start to aggravate the annulus, which we've talked about 1,000 times, which causes that inflammation and slowly over time can start to cause the tearing of the annulus. Sitting too long can actually cause your discs to start to herniate. Why? Because they're in the flexed position. And then any flexion on top of that tends to aggravate it and make it that much worse. So number 1, you get the creep. Number 2 is the disc starts to push out. Number 3 is you get tight hip flexors. And tight hip flexors, what happens is the muscles that support the hip in the front, which is the flexors, which allows you to lift your leg up like that. That's your hip flexor. When you're seated for long periods of time, that muscle, the hip flexor, gets very tight. And a very tight hip flexor causes it to get, sort of pulls that hip up in that position. But more importantly, what it does is it starts to cause some glute amnesia. So when you get the tight hip flexors, what it does is it forces the spine into a position because the muscles are tight where it forces the disc out. Same thing. That's the second reason that you can get the discs to push out. What happens over time when the hip flexors are too tight? It's called reciprocal inhibition. As I lift up my arm like this, my bicep contracts. As the bicep contracts, the tricep relaxes. Muscles that revolve around the joint or cause joints to move, they communicate with each other through the nervous system. It's called reciprocal inhibition. So what happens, tight hip flexors over time cause the nerves to slowly turn off to the glutes. And when you slowly turn off the muscles, the nerves to the glutes, the muscles get weak. And that does one very important thing, is it will cause these muscles to get weak. And when these muscles get weak, you don't use your hips to bend. Weak glutes, you don't use your hips, you use your spine. And when you bend over your spine, what happens is the nucleus pushes out even further. We call them spine benders. You're not supposed to bend with your spine, you're supposed to bend with your hips. But when your glutes are weak or you have glute amnesia, the glutes don't work, so you bend with your spine. Very, very, very common. And then you develop what's called lower cross syndrome. You get tight hip flexors, tight erectors, weak abdominal muscles, and weak gluteal muscles. And then you don't bend with your hips, you bend with your spine, and spine benders will have their discs wear out even faster because the discs are not designed to be flexed on all day long. You flex on the disc starts to herniate. It's the same thing as hitting your thumb with a hammer. I don't have my hammer here, but if you keep hitting your thumb with a hammer, what's going to happen is it's going to become very swollen, and that's going to become very, very, very sensitive to the point where you blow on it, it's going to hurt. It's oversensitive from all the inflammation. The spine does that. Okay, and what we have found by using MRIs is patients that have pain when they're in the seated position, when they flex, the nucleus pushes out and aggravates it every single time. And it gets worse. Okay, so here's what I advise you to do. There's a couple things you have to do, but number one is you do the seated stretch. What you do is you sit in your chair and you slide to the edge of your chair with your knees pointing out just like this. You drop your arms down to your side and you rotate your arms back. And as you do that, it puts your spine into a position where that flat curve then becomes curved again. Typically, if you have back pain when you're seated for too long, you do this, it feels good. You want to do things to make your back feel better because what it's doing is taking the pressure off the disc. So every 30 minutes, you take this break, shoulders back. And then as you're doing that, you're going to pretend like you're blowing out a candle that's maybe 6 inches in front of you. You're going to go. And as you do that, you're doing the bracing. We talked about the bracing the other day. Number one exercise, bracing. You have to learn to brace. It's not hard. You just have to retrain the muscles. So you take the posture break every 30 minutes. Now, I got better. I went through all these things. We've treated 26,000 patients, and we found a way out for you that you can do at home. Our goal is to help you rearrange or eliminate the ligamentous creep, eliminate the tight hip flexors, reactivate the glutes, fix your posture, take the pressure off the disc. By-step process. We've talked about this before, and this step-by-step process walks you through all aspects of why you have back pain and what you need to do about it. And in the end, our goal is to make sure your back is strong, resilient, and tough. Because it's not the load, it's the load you're not prepared for. So we're going to prep you for everyday activities. That's what this process does. Makes you more durable. Allows you to do the things you want to do. Allows the discs to heal. Takes the pressure off the discs. Eliminates the sensitivity. That thumb that you kept whacking with the hammer gets better. Better posture, healthy movements, and strength. That is what you need for a healthy, functional spine. I know, I lived it. Prevents future episodes of back pain, stops you from being a spine bender. Don't be a spine bender. There is hope. There's hope for everybody. We've treated absolutely the worst patients on the planet, and they got better with this program. Who's the worst patient? We had a patient that had 6 fusions, not at once, 6 separate spinal fusions. He got better. This program works. Gives you control of your spine. It empowers you. It empowers you because now you've got the control to make your life better, stronger, healthier, and you are independent of the back pain and you are independent from treatments that didn't work. Okay? We eliminate that. There's freedom. That's the goal.